In his last movie, The Shootist from 1976, John Wayne plays the character of J.B. Brooks. In the beginning scenes, he is diagnosed with advanced prostate cancer. "You told me I was strong as an ox," he says to the doctor, who is played by James Stewart. The doctor replies, "But even an ox dies." This scene is a reminder that no matter how strong, no matter how alpha a man may feel, fatal disease is lurking around the corner for every ox on earth. And when it comes to health issues, men tend to be stupid donkeys. Archaic masculine gender norms often result in risky lifestyle habits and ignorance towards the subtle signs and symptoms of dangerous disease. Once cancer causes pain, it is a sign of late-stage disease. I think the movie is not very realistic here, because if pain drives a man into the doctor's office, it very often is lower back pain from bone metastasis, not pain in the prostate area from sitting. In the beginning stages, cancer generally doesn't hurt. Prostate cancer may present with subtle lower urinary tract symptoms, such as urinary urgency, frequency, and weak stream. Already here, it becomes obvious that these are also the symptoms of benign prostatic enlargement. So there is a substantial overlap to benign disease here. In men above 50 years, occasional blood in the urine or semen might be another sign. Blood in the urine has always to be sorted out, but blood in the semen occurs quite frequently also in young men and is no sign of disease as explained in this video. But by the age of 50, men are at risk of having prostate cancer. The risk then increases and peaks by the end of their 60s. Prostate cancer is a real threat, as it is the second most common cancer in men and the fourth most common cancer overall. What many men don't know is that prostate cancer may not be the end, because medicine has advanced a lot since 1901, the year the movie plays in. But even since 1976, that's when the movie was shot, we have made groundbreaking progress. "I would have to gut you like a fish," says the doctor in the movie. Fortunately, surgery has advanced a lot since then, and there are also non-surgical options with radiation therapy. But if we just take surgery for a second, it by now has become minimal invasive, with robotic prostatectomy on the way to becoming standard of care. And since most patients are diagnosed early by the help of the PSA test, nerve-sparing prostatectomy is possible in most cases. Since prostate cancer is a realistic scenario for every man should learn the basics of prostate cancer. 1 in 8 Caucasian men and 1 in 4 men from African descent will face a diagnosis sometime in the second half of their lives. The earlier it is detected, the greater the chances of cure. Unlike most other cancers, there has been major progress in the treatment of prostate cancer during the last decade, so that it has become a more chronic and less deadly disease. So depending on your personal risk profile, I advise you to get tested once by the time you turn 45, and if everything is okay, start with regular testing at the age of 50. If you have close relatives with prostate cancer, or if you are from African descent, you might even consider getting a first test by the age of 40. I have uploaded more videos about prostate cancer that will help you to understand the chances of PSA testing, but also the risks involved, so that you will be able to make a balanced decision. Because there may be personal reasons why a screening test for prostate cancer may not be advisable. Thanks for watching. Bye bye.